According to the CDC, 43 million Americans have some sort of substance abuse disorder. In 2022, drug overdoses killed 110,000 people. The majority of those deaths were related to opioids, and today, people across the country are taking part in Overdose Awareness Day to help stop some of the stigma that comes with getting help and treatment.
Denver 7's Danielle Kreuter has details on a piece of legislation introduced today that would help get a life-saving drug to more people who are at risk of overdosing.
Advocates across the country hoping for change when it comes to overdose deaths.
This is a public health emergency that demands a public health approach. So doubling down on the worst ideas of the drug war, which are incarceration and criminalization, has never worked, and that will only increase overdose deaths.
Since 2022, nearly 1,800 Coloradans have died of a drug overdose.
Sorry. This is my first time back since I visited the ER. And some of you had to tell me that my mom might not make it.
Standing outside the hospital that saved her mom's life, U.S. Representative Brittany Pettersen shared her story.
My mom hurt her back like so many people. She went home with bottles upon bottles of opioids. After her back recovered, my mom found herself wildly addicted. Ultimately, my mom was cut off of her prescription like so many people in the United States without access to treatment. And we were ripe for the distribution of unfortunately heroin from the cartels.
Her mom was treated for overdoses over the years.
And they're struggling with addiction, or they've had an overdose. The last thing that we want is for them to go out into the community, have another overdose, and to die. And the most powerful tool that we have to prevent that from happening is naloxone.
Naloxone, or Narcan, is life-saving for someone overdosing. Yet, there have been restrictions on sending patients home with it.
You just don't want to give antibiotics to everyone because suddenly we'll have resistant bugs. Or let's say chemotherapy drugs. Sure, we should tightly regulate those. Naloxone has only one purpose and has very little side effects.
Rules at the state level have been loosened, but a new bill introduced aims to take that concept to the national level. The Hospitals as Naloxone Distribution Sites Act would also require Medicare and Medicaid to cover the hospital's cost to give the drug to high-risk patients when they're discharged.
Tries to correct one of those cardinal sins, which is the sin of not providing life-saving medical interventions when people need them.
I'm Danielle Kreuter, Denver 7.
The final language of this bill is expected to be finished by Monday, and Congresswoman Pettersen says she's hopeful this will get bipartisan support.
And looking closer now, the drug used to reverse opioid overdose is expected in retail stores and online as soon as next week. Beginning September 5th, Narcan will be sold in stores and online at Rite Aid, Walmart, and